And now you know why our exercise class has 381 members. Mary makes it just so much fun. So if you aren't already, go ahead and sign up for that class. Our next presenter, for a lot of you, needs no introduction. She's a good friend of yours and good friend of WPA's, Dacy Reimer. Dacy Reimer is a nurse practitioner at Neuroscience Group in Neenah. She specializes in the diagnosis and treatment of movement disorders and dementia. She's an author and a certified research coordinator, and she has managed more than 30 pharmaceutical studies using experimental therapeutic agents, many approved for use today. Hello, Dacy.
Hi, Gary. How are you? Okay, are we on? Okay, super. Sorry about that. I really appreciate everybody coming out today and staying tuned for all of the information that's been presented. I've been trying to tap in as much as I can myself to hear some of the presenters, just because I think that it's interesting, and I've been able to take home a few pieces of my own. So, you know, my talk today is on nutrition and complementary medicine, but I really like to think of this more as a discussion on how we go about changing our ways for better brain health. And this really applies to everybody. And we really try to incorporate a lot of information for caregivers. And this piece is really for people with Parkinson's and caregivers. And I feel that even in my visits with my patients, that it's really key to have the spouse or a caregiver with when we have this discussion, because if you don't do it together, if one person in the household has habits different, especially eating habits different than the other, then we're not always successful with how we shop and how we make meals and how successful we are in making some changes in life. Just to give you a little bit of background on this and why this topic is really important to me. I have a family history of Parkinson's disease as well. My grandfather, my dad's father, we called him Papa, had Parkinson's. His sister had Parkinson's as well. And, you know, a lot of times I think we think about disease states and illness, and we don't make any lifestyle changes until they've hit us. Well, I don't have Parkinson's disease, but I also have never had a stroke. I've never had heart disease. But with my medical background, I definitely know I don't want any of those things either. So I definitely try to do my best to live a lifestyle that is healthy and that will preserve my brain function and my cardiac function. And I think that it's important that I practice what I preach. Research on nutrition many years ago, but started really making big lifestyle changes probably about 6-7 years ago myself. And I did that really to ward off, especially dementia. That's something that the more I see, and so I've made those lifestyle changes myself. And I've actually noticed some improvements in my own health, especially, and I tell this story once in a while to people. I have rheumatoid arthritis, and what I've learned in the last few years is my episodes of these flare-ups have just naturally diminished. I used to have to be on a prednisone dose pack about every 3 to 4 months, and now it's been 4 years since I've been on prednisone. And the only thing I really changed is my exercise and my eating habits. And also kind of my mindset on my stress level and things. So I really believe that these suggestions that I'm going to make to you today have a big impact on health. And to me, they've had a bigger impact on my health than I expected. So I think that we can ward off a lot of disease states when we practice this. And we can also heal our own bodies. The reason why I'm trying to share a lot of research information with you is it's easy to come on and just say, well, you really should be eating healthy and you probably shouldn't be eating fried foods and you're going to go yada, yada, yada. But I think when you back it with data and the fact that we've have more researchers and naturopathic medicine and things looking and collecting data on the benefits, when we back it with information, it validates it and it gives you greater insight on what those changes can do for you and your body. Next slide, please. So in the last decade, we've made huge advances in our knowledge on disease states and what makeover improvements in your diet can do for how your brain functions. There was a large study done by AARP that found that 90% of us want to know how to make those changes and feel that health and diet changes are really important. We just don't know how to do it. And so that really is the key thing. How do we go about making these changes? Which ones are the most important? And where do we get resources? In medicine, we're really good at being defensive about health. We wait till it gets here. Somebody's had a stroke. Now they have diabetes. So now we start educating on a diabetic diet or a cardiac healthy diet. Well, my goal is to really kind of push and think ahead more. And that's why this information and this program is for people with Parkinson's, it's for caregivers, it's for family members. I consider this information good for my friends and my family. And it takes, there was a study done that showed that it takes 17 years for scientific discoveries to actually hit mainstream practice in clinical practice. And that's just regular research. That has nothing to do with diet. And I feel that when we talk about nutrition and proactive health measures, there's even more lag time. There's less talk about that at visits. We're lucky if we get in enough information about new changes to medicines and what's going on, and here's your new dose, and get you, and then you're out the door quick. You don't even have that conversation about what you should be eating or how that could potentially heal your body. So I think that it's a big piece of information that we miss at visits. And also many of our guidelines that are out there are actually quite out of date. There are a lot of new recommendations that aren't being utilized in clinical practice. And I think it's really important for us to take back control, and take back responsibility for our health, because right now you go to doctor's visits and all the power is there. We essentially give it all away. And we also give away a bit of our ownership for our own bodies. It's almost a learned helplessness, right? We give that control to the doctor to fix for us, but we don't take a lot of responsibility ourselves for our health and our state of well-being. Next slide, please. So there was a large study that was conducted in 2009 by the NIH, the National Institute of Health, called the Human Biome Study. And in this study, what I essentially want to kind of wrap up in a little tidy bow here is the fact that there is a huge connection between our gut and our brain. A lot of times, and in the past when we've reviewed any research, we are always assuming that these things that happen, like plaques and tangles we see with Alzheimer's disease and what we call alpha-synuclein in the brain, which are protein buildups that can lead to dementia and Parkinson's. We think they started there because that's where we're looking. Well, what we found with this human biome study is that that there are trillions, 100 trillion microbes in the gut, and that they strongly influence our brain. They travel up the vagus nerve, and it increases inflammation in the brain, when we don't have good gut health. So our goal really is to make sure that when we're thinking about our environment, and you might think, well, my environment, I really don't smoke, right? I don't want to put that in my body. You know, looking at chemicals or different exposures. Well, food is part of your environment. And so what you put in is a very big part of your environment. So what you put in your body matters a lot. And so 70 to 80% of your immune system is actually in your gut. So your diet optimizes that microbiome. So some of the things we're going to talk about today are prebiotics, probiotics, and you might not have ever heard of any of these. What the healthy fats are, talking some about gluten-free and why that would be important, as well as antioxidants. Next slide, please. And I'm not going to spend a lot of time on certain slides only because we've got I want more meat and potatoes and what you can do to make change, but I've got to give you a little bit of the science behind it. So this slide basically shows the effects of inflammation on the body. And what we know is that even more recent research shows that people who have diabetes and constant sugar spikes are more apt to have Alzheimer's disease. Those sugar spikes make a lot of difference in inflammation in the brain. And so that increased inflammation in the body is what leads to dementia, autoimmune disorders, cancer, depression, and many respiratory disorders. Next slide, please. So there's this neat project called the Blue Zones, and I'm not going to get into great detail in this, but for those of you, I don't know where everybody's coming from, but we actually have in Dodge County a city that is working as a Blue Zone project. And what this is that there are certain areas that we know in the world have a lot of centurions or longevity. And this whole research was investigating, well, why is that? What are they doing differently than we're not doing here? And the key to that, and these are kind of the major blue zone areas, the Okinawa, Japan, and Sardinia, Italy. And the main issue or things that they found common in those areas are the Mediterranean diet. They found that they're set up to where their communities, there's a lot of activities and accessibility to family and friends, and that there are certain criteria that these people have in these cities that help to increase their longevity. Next slide, please. So we all know that term, you are what you eat. Well, it's actually pretty true. So what we eat is one of the most important decisions that we make in a day, and it really does regulate disease states, and that health of the microbiome determines whether you're fanning that flame of inflammation or if you're squelching it. So we're going to get into a little bit more of what the Mediterranean diet and how we can go about decreasing the inflammation in our body to ward off disease states. Next slide, please. This is a little bit more research, again, in case you need more proof in the pudding on why you should do it. So there are a number of studies that show this. Finger trial in particular was the world's first ongoing large-scale long-term trial on these lifestyle changes and cognitive function. And after 2 years, they found that the people on a intervention of a Mediterranean type diet increased their cognitive function by 25% compared to the controls, meaning the people who weren't on that diet. And then what's called executive function increased by 83%. Your executive function is a lot of times what we see as a deficit with Parkinson's disease. It helps us with sequencing. So you might think it's really easy to walk in a room and sit in a chair properly. But with Parkinson's, we tend to see that a person will walk in the room and go to sit in the chair and they won't quite be on the chair right. Their brain didn't process that sequencing and how to sequence and position their feet to be able to sit on that chair without catching the edge of it instead of getting on properly. And it also increased the processing speed by 150%. I want you to think for a minute. If you've just, well, we think about Thanksgiving a lot of times and the food that we eat there, and then we get a little sluggish afterward. Fish fry or a dinner that has a lot of fried food or fatty foods. And then we end up coming back and we do feel a little more brain sludge as well as sluggish in the body as well. So if you really time to think about it, you'd be able to put together the fact that there are times in your life that you've eaten healthier and felt like you've had more energy, and the times when you've fallen off that wagon and you do feel like you're bloated or more frumpy or just have less energy. And, listen to your body. It's telling you something. So our recommendation is the Mediterranean diet, which is rich in vegetables, extra virgin olive oil, nuts, legumes. It's low in red meat. Those areas, especially in all those countries that I had listed before, don't always have a supply of red meat. So it's usually something that was for special occasions. So they use a lot more vegetables and things that they can grow, more fish and seafood, and less of red meat. They have a low intake of dairy, and they're not afraid to have a glass of wine with dinner. Next slide, please. So what are good foods, right? We want to kind of cover this because it's important. One of the things I try to say to people is, if we're going to start talking about change, change is not always easy. I have had people come into me and say, well, what's a good diet? And we'll sit down and talk about a Mediterranean diet. And they are going to go home and they are going to knock this out of the park. They are going to go both feet in and make a 360 change in what they eat. And that's great if you can do that, but I haven't seen that become always successful. So my goal today is to tell you which foods are good, which ones are not, and give you the capability of starting to make some moves on the chessboard to introduce the good foods in and remove some of the bad. It doesn't always happen all at once. Now, you might be one of those people that need it to happen all at once, and that's good for you, but that's not everybody. You also may look at all of the things that I'm showing here and go, yeah, I don't eat Brussels sprouts, so you're never going to get me to eat Brussels sprouts. Or avocado. I've never eaten avocado in my life, and I wouldn't even know how to open it. So, and that's realistic. But I'm going to give you the information on why these are good for you and what they do to your body, and give you a variety and let you choose. Okay. I'm also going to try to give you some resources of where you can find recipes and things, because everybody is very different. I can't put up here a template and say you have to follow this, and this, because you might not be able to get certain things at your grocery store, or your ability to cook complex recipes might be different. You might need something that's 5 ingredients or less. Everybody's a little different on that. So there are times that people want meat, they just really want to know, what do I do? Just give me the exact instructions and set me on my way. But it's really not that easy to do. So Brainiac Foods. These are dark leafy greens. Okay. So if you're eating a salad with iceberg lettuce, and it's not necessarily a bad thing, there's a lot of water in it, But I want you to keep in mind that the darker the color, the darker the green, the more nutritious that it is, okay? Just even 2 servings of that, dark 2 servings of dark leafy greens per day, okay, can make a difference on scans. And it's actually something that we can see on scans as well. Wild Alaskan salmon is the highest in what we call long chain omega-3 fatty acids, and that has been shown to reduce inflammation as well as lower your blood pressure and risk factors for disease. Here's the avocados, people. So avocados, if you haven't eaten them, might be a little bit new to you. I always make sure that I have a whole avocado in a day. So it just depends. It might not be all in one sitting. Some people don't like avocados, but they are actually very, very healthy for you. They're a good fat. They are higher in fiber. They have the ability to increase the nutrients of other foods that you eat along with it. So avocados are good. Blueberries are really high in antioxidants and can help with brain memory. Extra virgin olive oil, and I'm going to get into this a little bit later with kind of good oils and bad oils. Extra virgin olive oil and for me, coconut oil are really the only 2 oils I have in my house. Everything else I've gotten rid of. I use extra virgin olive oil when I'm cooking for like savory foods, and I'll use coconut oil when I'm baking, or it's, you kind of want that sweeter taste. Next slide, please. Some more Brainiac Foods. The egg debate. So eggs, we've all heard for years back and forth on whether or not eggs are good for us. But when we're talking about the brain, we do like eggs, and they increase what's called acetylcholine, which is our learning neurotransmitter. So go ahead and eat your eggs. And in the morning, I tend to do eggs with avocados. I put a lot of, I kind of make mine Mediterranean. I'll do some fresh dill. I do eggs. I put the avocado. I do some cucumbers, some tomato, and then some crumbled feta cheese. And that's kind of my breakfast in the morning. So that's where I kind of add in some avocado. And you might not think of avocado and eggs great with each other, but they're really good. Grass-fed beef. So if you're gonna, and when we mentioned before about beef and cutting it down, you really only want it a few times a month. It'd be preferred to be grass-fed. You're eating what the animal ate. Okay, so grass-fed beef has, if the grain-fed beef, grains tend to increase inflammation. So the grass-fed beef is less likely to cause inflammation in the body as well, and has less omega-6. We don't want high omega-6, okay? Cruciferous vegetables. These are always, cruciferous is so fun to say. But this is your broccoli, your Brussels sprouts, cabbage, kale, bok choy, arugula, radishes. And these are very, very good for you. So if I kind of stress to people about vegetables, I really push the cruciferous vegetables. Again, if you don't like Brussels sprouts, but you do like broccoli, great. You'd also have to take into consideration other health issues. Some people can't eat vegetables that increase like their hiatal hernia problems and things like that and cause more gas. So clearly take that into consideration, and that's why I definitely do one-on-one counseling with my patients. I look at their health history, I look at the other problems that they're having, and then you can make better decisions on what foods to eat. Next slide, please. So guess what? Dark chocolate's okay, and you just can't eat too much of it. I had a Zoom appointment yesterday, and one of the spouses said, well, with COVID, I haven't been eating as good. And they actually were one of my patients, and we've been talking a lot about changing a couple of labs that we've been watching, and I'll go over that a little bit later, and changing their diet. And they had been doing really good until COVID hit. And then they feel like they're a little bit more depressed, and they've been kind of seeking out more comfort foods. Well, you can have some dark chocolate, but you really want it to have 80% cocoa or higher. So, and you want it to be not processed with alkali, so Dutch chocolate processing. And yeah, that's not the creamy, cocoa or chocolate that you might be used to, but that's actually the healthier one to eat. So nuts are healthy. They're very rich in antioxidants. Pistachios are one of the healthiest nuts that you can eat, as well as almonds. So just watch that you are not getting that you only want fresh or dry roasted. Okay, you don't want them cooked in oils and at high heat. So my last tip down there is a shopper's tip, to consider that you want to shop the perimeter of the store. Okay, think about it once. The middle aisles tend to be more of your canned or processed foods, right? Around the perimeter, you've got your vegetable department, your produce department, your fruits. All of that is fresh. Obviously, if it's farmer's market season, go out and get really fresh. Now, if you're at a store that isn't always the freshest, that might not be the best option then. You do want it to be that you're getting fresh produce, otherwise that food does degrade. Frozen's not bad. They actually flash freeze pretty quickly, so most of the nutrients are maintained, but fresh is better, of course. Otherwise, the more processed foods tend to be in the middle of the store, and the more refined or more processed, the more trouble our bodies have in digesting it. And also it increases the inflammation in the body. So keeping it as natural as possible. Next slide, please. So I mentioned to you at the beginning about prebiotics. And prebiotics really act as a dietary fiber, and it's a fertilizer for the good bacteria in your gut. So you might not use all of these things. And like I said, you can kind of pick and choose what you like, or try something new. Apple cider vinegar, chicory, artichokes, garlic, onions or shallots or spring onions, leeks, cabbage, and then those cruciferous vegetables that I talked about before are all prebiotics. They set your gut up for good bacteria. Probiotics are live bacteria that are helping to restore that gut flora. One of the things you probably think of is yogurt as probiotic. I would just caution that you don't want like the sugary Yoplait yogurt. You know, if it's got a lot of sugar in it, you don't have a lot of live active cultures, and you're going to end up with a sugar spike as opposed to helping your gut flora. So really more of an authentic Greek yogurt is what you want to incorporate more. But anything that is fermented, so sauerkraut, pickles, buttermilk, kimchi. I love kimchi, but many of you probably don't even know what that is. It's more of a kind of a spicy Korean cabbage. But I had Korean neighbors, and they introduced it to me when I was a kid, and now I crave it. So definitely love kimchi. Next slide, please. So what don't we want to eat? So those are some of the things that we do want to incorporate. What don't we want, and why? Grains are a little bit of a touchy subject, and it's not like, when you think about Mediterranean cooking, they certainly have pasta, don't they? So that is part of the Mediterranean culture. But I want you to keep in mind that what we think of as pasta here in the United States is quite different than a pasta meal that you would get in the Mediterranean. We tend to really load up the plate with a lot of pasta and some sauce. There's not necessarily a lot of vegetables in there, and it might have more of your thicker Prego tomato sauce and things like that. what I want you to start thinking about is downsizing the pasta quantity, and looking for more whole grains as well, and making sure that you've got more of the vegetables and more olive oil and that type of stuff in that pasta, rather than it just being, you know, a big bowl of what I kind of refer to as gumming up the brain, you know. So it's really has a lot of gluten in it. So gluten can be found in wheat products, barley, rye. What I really want you to take home in this is that it's really heavy in processed, refined, like white bread, the white pastas, and that you really want to think about even sprouted bread. All of the energy has gone into the sprouting process. And so your body delivers the glucose in that at a much more stable rate than you get in white bread. White bread changes completely. And these insulin spikes throughout the day cause a protein called beta amyloid to accumulate in the brain in Alzheimer's disease. So people with diabetes are at much higher risk of getting Alzheimer's disease. Also, stop eating 2 to 3 hours before bedtime. Some people, and myself included, go through what's called intermittent fasting, and that's actually good for your body. And some people fast, when we think of fasting, it's really when did we stop eating at night? And then we are fasting and we're giving our body a break, until morning, till we've eaten our first meal. So you are reducing that circulating insulin when you stop eating 2 to 3 hours before bedtime. Next slide, please. So refined sugar. And sometimes when I have my patient visits, this is actually where I start. If you're the type of person who wants to make some lifestyle changes and take control more of your health to be able to feel better and have more energy and ward off any potential dementia, especially, I always say start out with sugars. If you're not going to do anything else, start with sugars. Start looking at your labels and look at your refined sugars, your high fructose corn syrup, and all of these things, these hidden offenders that I mention on here. And I know my slides have quite a bit of information on them, and that's not typical when you do PowerPoints, but I also know that you guys are probably trying to write all this down. So I'm trying to make it to where when the WPA is able to send this to you, a lot of information is already written down. I believe that you're going to be able to download my slides too, because it's hard to retain all of this information and know exactly all of these hidden offenders and be able to watch for them on labels. But so they are on here, and you want to just start looking at those types of sugars, and some of them sound healthy and other ones you can't even pronounce. But you want to try to clean up those refined sugars and have sources that don't spike, because that will increase your risk for dementia. So I always say first thing to do is start looking in your refrigerator, start looking in your pantry, and learn about labels. I had recently, I was driving with my husband, and he was back at the gym and eating healthy, and he went to the gas station. We got gas. He came back out, brought me a water, and he had this drink that he put in the in-between. And he says, this says that it's healthy. And I'm like, oh, neat. I'm always reading labels. So, me, I pick up and I read the label on it. It had more sugar in it than a Mountain Dew, and it was labeled healthy. So I don't ever trust labels. I read what's in it, and it's good for you to get familiar with ingredients and sugars and carbohydrates and things like that, so that you can read the labels and make sure that what it's toted for is the real deal. Next slide, please. So oils Like I said, I kind of narrow it down. I like to just, you can get pretty confusing with a lot of the oils. In my house, I literally have the extra virgin olive oil for that savory cooking, and I use the coconut oil. You can also use avocado oil, which is a good oil as well. But I use coconut oil and the extra virgin olive oil. If you need to use butter, and sometimes there's a need to use butter, it's better to use grass-fed butter. That tends to be touted as more of an Irish butter. And even if you look at it, it's a richer, darker looking butter. And that's a grass-fed butter. So when you are cooking with oils that are processed oils, and especially when you're cooking at high heat, you're increasing oxidation at that time and what we call free radicals. The free radicals don't sound good, and that's because they're really not. They're really detrimental to the brain. They cause more inflammation that leads to Alzheimer's disease, Lewy body dementia, MS, and Parkinson. So you really want to avoid those processed oils, and especially avoid them at a high heat, okay? Because that high heat denatures them and makes them worse. So you really want to use your oils at a lower to medium heat. Next slide, please. So before I get to the water, I just wanted to mention, so a lot of times people say to me, well, and I'm going to give you at the very end of this part some resources that you can read more about foods and their effect on the brain, as well as some resources for cookbooks and that type of thing. What I also wanted to mention, and some of my patients have actually brought this to my attention, is that getting started on this can sometimes be difficult. And so I think you really need to pick up cookbooks, and you need to shop around. So you need to hit your bookstore or, look online, but kind of get to know what the book looks like. For me, I like pictures. So I want to know what this food's going to look like. And if it looks appetizing, maybe I'll make it. But if it doesn't look that appetizing, I'm probably not even going to read on. I'm just busy. I've got better things to do. So I kind of like the books with the pictures of what the meal looks like. So I know what, if I put it on the plate and it didn't look anything close to that, I probably goofed it up. So I really like cookbooks, but I think that you need to take a look at them first, see how long the recipes are, how complex the ingredients are, and how much time it takes to prep it. If there's too much prep time, or it doesn't seem realistic that you'll get it on the table in time, then it might not be for you. Right now, I think during COVID is probably a good time to be doing this. And I say that because, well, you have more time to focus, and sometimes we need to try to figure out a focus on something good, because a lot of people during this time, a lot of my patients have kind of slipped into more depression. They haven't been able to get out and exercise as much. When you're focusing on your diet and improving it and good health, you're involved in making yourself better. You're not waiting for your doctor to give another pill that's supposed to make you better. You're helping to improve your own health. You're taking an active role in it, and you're doing it hopefully with your spouse or your caregiver. That's work every day towards positive. And I think that we all need that. I think that we all need to be involved, and we have to make a concerted effort to be a participant in that, and not just sit back and receive medicine. And I'm getting more and more people who want to be more healthy naturally. And, but I do have people who come in and they bring in a bag full of supplements. And these supplements are meant to make them better or be more natural ways of treating their memory or Parkinson's disease, or it'll give them a little bit better clarity or whatever the deal might be. And I guess my take home is, if we're really doing it natural, is taking a pill supplement any better than taking a pill for your Parkinson's disease? You're still not an active participant, and it's still not the body's natural way of healing itself. We're not supposed to get those nutrients in a pill form necessarily. We're supposed to get it from our food. Our body naturally repairs itself and has that capability with vitamins and nutrients. So I really strongly urge you to make sure that the goal is to do it naturally with food and not so much with pills and supplements. So the next part is water your brain. Your brain is 80% water, and I can't express enough that we need to make sure that we stay hydrated. And I see this a lot. If you don't stay hydrated, you're going to be dizzy, especially with Parkinson's. You're going to have a blood pressure drop. You're going to have dry mouth, headaches, fatigue. Water is absolutely needed. You're going to have muscle cramps as well. There are many different ways that we can get water. So you obviously can just drink it, but many people find that if they drink too much water, then they run into the bathroom too much. Well, that's because you might be drinking too much at one time. Next slide, please. So make it more tasty, okay? You can add some mint to it. You can add some lime to it. There are drops and flavors that you can add to it, or Crystal Light, as long as it doesn't have too much sugar. Watch the label on the things that you add to it, that it doesn't have too much sugar, okay? You want to make sure that you're sipping it and not chugging it. I have this fancy lights up every 30 minutes to remind you to drink. So this little button kind of, when you turn it on, it'll light up every 30 minutes to remind you that, hey, you haven't drank recently. Just know that your body only absorbs about a Dixie cup of water every 30 minutes. So you go, I'm going to just, Dacy told me to drink more water, and I'm going to sit down and drink this whole thing. Well, you're going to absorb about a Dixie cup, and then you're going to have to find a bathroom, and the rest is just going to make your bladder go burp, and you're not going to be happy, and especially if you're out in public. So most people say, well, I'm not going to drink a lot of water because I'm going to have to go to the bathroom all the time. So sipping on water all day will help to alleviate that and actually allow your body to have the time to hydrate. So keep that in mind. Next slide, please. So keep it nutritious and choose real food over supplements, okay? You want a high fiber diet. You want a diet that's high in antioxidants, because those antioxidants repair those free radicals, and those free radicals we don't want. So look for brightly colored fruits and vegetables. I always say, the ground that we plant food in, the richer the soil, the darker the soil, right? And it has more nutrients in it. Same with the things that come from the soil. So the darker the color, the richer in nutrients. So you want to make sure that you're drinking or eating from a rainbow, that you're eating things that are rich in color. Green and black tea, you take of that. That's also a kind of a nice substitution if you don't want just plain water. Make it sugar-free, green and black tea, and increase your beans and legumes. You want 5 servings of fish per week. For some of you, that might be really unheard of and not unlikely. That doesn't mean it all has to be Alaskan salmon. You can change it up. You can have tuna steaks. If you like your steak and you're giving up red meat, switch it for tuna steaks. You want a moderate amount of protein consumption. And that probably you've heard with Parkinson's, if you have a diet that is really high in protein, then it can impair the absorption of carbidopa, levodopa. So then we want that moved outside that window. We want to take the carbidopa, levodopa an hour before or after eating a high protein meal. So keep that in mind. play with herbs and spices. You know, we're talking about flavoring foods, and it can make things so much more interesting. I even take herbs that I've grown in the summertime, because I always keep them, or I always have them around, and I'm always growing them. And I'll chop them up and I put them in one of those flexible ice cube trays with extra virgin olive oil. I freeze it, so I have like sage and rosemary in there, and then I put it, you know, crack it once it's frozen and put it into freezer baggies. And I've got herb infused olive oil in my freezer all the time from my own garden. Next slide, please.
Hey, Dacy, this is Jeremy. I'm going to jump in. We're about 10 minutes to the hour here, and I want to have a few questions that have been asked. The good news, I'll tell people, your last couple slides were on meditation, and we put those slides on our website so they can find those, and we'll go through some of the resources you put on there. So first of all, thank you. Some of the questions that have come in, one was, you talked a lot about fruits and vegetables. Do they have to be organic, or can I eat other fruits and vegetables? Am I going to get the same benefits?
Well, obviously organic is better because you have less pesticides and things. If you can't get organic, you just want to make sure that you take them home and clean them, and especially like your fruits, you know, they shine up those apples with wax. They, you know, you'd be surprised what's all on them. So you just want to make sure that you take them home, and that's where you can also use the apple cider vinegar to help take any coating or bacteria and things off your blueberries, and that if you want them, they definitely last longer as well. So if you can get organic and that's something that's available to you, obviously, and part of it can be price. You know, organic can be more costly and maybe not in people's budgets as well, but definitely when we're talking about less exposures and chemicals and things like that, organic is better.
Okay. One of the other questions that was asked was, how do I get calories into somebody who's maybe underweight, but has trouble eating and is having some issues and maybe later stages of Parkinson's disease?
And that really is something that should be taken up in a visit, you know, with your provider or even with a dietitian and looked at, because there can be other medical complications, especially GI type absorption issues and things that would need to be discussed. And, you know, our goal there isn't just to load people full of, you know, fats and lipids to fatten them up. It really is about healthy foods, again, because they're not going to function as well and have as good of cognitive function if that's not looked at closely. So I really tend to say that's more individualized and not something that I would generalize on.
Okay. And then the last question I'm going to ask, because it's come up twice today, how do artificial sweeteners, such as like sweeteners in a Diet Coke, how does that affect Parkinson's and mood based on your experience?
Yeah, well, again, you know, we're always trying to avoid things that are a bit more synthetic, you know, I mean, and go as natural as possible. I'm a beekeeper, so I like honey, but it has some good antibacterial components too. So, and there's tons of research out there that shows that a lot of the sweeteners that are in like the diet sodas and things are actually much more worse for our body than some of the more typical sweeteners. So I tend to tell people to avoid them.
Well, thank you. There's other questions that have been asked. We will get to those at some other time, just in the sake of time right now. It's 5 minutes to noon Central Time for those who are in different time zones. First of all, give Dacy a round of applause. Thank you very much. If you listen, Dacy, you can hear it. There's a lot of people in your backyard that are watching based on our feedback. We are going to take a short break. We will come back. Let's make a deal. We'll come back at 12:05. That'll give everybody about 10 minutes to visit with the vendors, really say thank you to them, ask any questions you have of the vendors that are out there. Come back promptly at 12:05. We will jump into the last presentation of our 3-day symposium. Thank you all for hanging in there, and we'll see you again in about 10 minutes.